And now, Spotlight Montana with Laurel Staples.
We told you earlier this year about Western Montana Mental Health Center in Missoula becoming the first certified community behavioral health center after being awarded a 2-year grant. The grant supports the center's transition to a new model of care. In this Spotlight Montana, we follow up on the transition and find out exactly what the new model of care means for those seeking help. And we also hear about a new crisis hotline called Lifeline.
We can talk about the Ccphc. I mean, we're still in a attestation stage of that grant. So we have these tasks that we're working on in regards to creating memorandums of understanding with community partners. And so, for instance, law enforcement and hospitals and other mental health agencies and aging services, schools. So all parts of community we have understandings with. Well, we've sent them out and hopefully we'll get them all back. So what that does is the essence of the Ccphc grant is to have available access. So if someone needs help, we're there to help them. And so it's not, there's some areas that have months and months of waiting time to get access for a mental health or substance use disorder appointment. And so the goal of the Ccphc is to have access available for people when they need it. And that's focused on crisis, and it's focused on substance use, and it's focused on care coordination or case management, outpatient therapy, and the physical aspects of health. So it's an integrated health model. So it's, you can focus on, our med providers can focus on the physical aspects of a person and then send them across the hall for a mental health evaluation. And so it's, instead of piecing it out to different entities, it's all inclusive. That's what I like to think of the Ccphc process as, is a one-stop shop. And of course, not for everything, but for the level of acuity that we see sometimes, it's for folks who need help, and they need help sooner than later.
Tony, your thoughts on this new model of care?
My personal thoughts are I'm excited for it. I mean, I think that's part of the stigma of mental health is getting care. We serve a lot of communities, and folks are apprehensive to put their car in parking lots that have the mental health center listed on the outside. They are much more preferring to have a mental health clinic inside of a hospital because it's just part of being a person. If I've got a broken arm or if I've got an anxiety attack, it should be the same level of care that I receive with minimized stigma or no stigma to that. So,
yeah, Tony, your thoughts on this?
I think it's a phenomenal model of care. I feel privileged to work for an organization that's putting this into place and just watching these cogs start to turn, and as we start to meet deadlines and, like Carrie said, develop memorandums of understanding within the community. I do think that the future is promising for Western Montana Mental Health Center with this model, and especially just being able to serve our community quicker with a better holistic whole person care. Because like Carrie mentioned, folks will go from one place to the other and they get triaged and tossed around. And sometimes the system can be very difficult to navigate. And I work kind of in an information and referral services portion of the agency. And so from that perspective, I think having most of the care in one single space is going to be really beneficial to the community and to the client base that we serve.
Well, take me through the steps as what happens first when a patient comes to the center under this care?
Tony, you want to cover that?
Sure, yeah. So, first the patient needs to solicit services, right? So they need to submit an application for services. And after that, they come into our access department, and we have folks that will be designated towards figuring out insurance benefits, whether it's Medicaid or if it's private insurance, and just helping that process get started while the folks get scheduled. And the idea, Carrie, correct me if I'm incorrect here, but is to get folks in within and scheduled within a 24-hour period of time. And that requires quite a bit of legwork from our access department, which we're really trying to boost up right now, and really make sure that we have the right individuals in the right place to just help folks walk through this process that can be sometimes pretty convoluted to navigate, especially if you're someone operating with a mental health illness. And so, yeah, go ahead, Karen.
Well, I just want to piggyback a little bit on that, and that also includes our crisis services. So we do have walk-in crisis services. So we have instant care for someone who's in an acute crisis situation. And so our Dakota Place in Missoula, and then we have West House in Hamilton, we have Lake House in Polson, Glacier House in Kalispell, Hope House in Bozeman, and Hayes Morris in Butte. So any of those crisis facilities, someone can walk in. We've talked with law enforcement in all of the areas, and they're able to drop off individuals who are in need of an assessment or possible placement. We have mental health professionals who can evaluate for possible higher levels of care if they need placed in a higher level of care. So we have that arm of care as well, the crisis and kind of instant assessing. And then, as Tony was indicating, the folks who just want to get in and get seen on a quicker basis. And then substance use disorder, we have Recovery Center in Missoula. And so we've got all inclusive. We've had all of these services for a long time. It's the CCBHC just kind of glues them all together and lets one transition from one service to another easily.
Yeah, it sounds like it really streamlines it. And what are some of those crisis situations?
Folks with suicidal ideations or psychotic kind of delusions, with depression, major depression. Coming out of the pandemic, we're seeing a lot of anxiety. We're seeing a lot of unsurety. With the housing situation in Missoula, we're seeing homelessness. Homelessness in itself is not criteria for crisis placement. However, it has many, many aspects to the homeless situation that creates intense anxiety. Folks seek out assistance for substance use disorder. Families call about family members and how to get help to them. We're very fortunate to have the mobile crisis in Missoula that's run through partnership in the fire department. And so this is a lot of community cohesion in regards to mobile crisis. The fire department, the police department, the sheriff's department, the county attorney's office, it does really take a village.
So how does someone reach out to the center?
Tony? Oh.
Yeah, so Laurel, someone can go on our website if they have access to an electronic device, and they can shoot an email off to our administration email, or they can submit an application directly to our access email, which is access@wmmhc.org, which is kind of that connection center hub I was talking about before, where folks can get triaged to the proper front desk for scheduling. Insurance benefits can get that going and rolling. And additionally, they can call. So we have a locations page on our website that delineates each of our locations throughout Western Montana, and the various services that are provided at those locations with phone numbers to the front desk. And our folks are always willing to take those calls and help people out in that moment.
A crisis hotline as well?
We do have prior to April 16th, we had Dakota Place as our individual crisis hotline. And then April 16th, we went live with Lifeline, which is housed at Western Montana Mental Health. And so that's the national 1-800-273-TALK. And if anyone is calling from the Missoula area, actually we encompass 7 counties. And so Missoula County, Ravalli County, Mineral County, Sanders, Flathead, Lake, Glacier, soon to be Glacier, and Lincoln counties. So any person who calls from those counties, it will ring in Missoula, and the Missoula team is we're expanding the hours now. Eventually, we'll be 24/7, and so if it doesn't get answered in Missoula, someone can call it 24/7. If Missoula doesn't answer, it will roll over and be picked up by Great Falls. And so we work hand in hand with the Great Falls folks and with the Bozeman team. And so it really, our expansion, our partnerships really do expand across Montana in regards to getting folks mental health help.
So tell me more about Lifeline. What made it possible?
I'm part of a coalition. To tell you how it started, I'm part of a coalition in Missoula, Project Tomorrow, which is a coalition of many Missoula partners, and it's suicide prevention. And we were talking one day about we need a local number in Missoula because we all have numbers. Western's got a number, the Y has a number, Winds of Change has a number. We have all of these crisis phone numbers. So we were talking about consolidating it. Well, lo and behold, one of the members of Project Tomorrow is one of the directors at Lifeline at the national level. And he happens to live in Missoula. And so I connected with him. And it's just community and how it works. And so we started talking about it, and we put the idea out there, and we made it happen. And we now have a Lifeline call center, which is phenomenal. And it's right across the parking lot from where I sit right now.
Tony, would you like to add to that?
Absolutely, yeah. As the Lifeline staffing coordinator, I've had the privilege of just watching this grow from getting the advanced communication software established to our partnership with the 211 Help Center and access to resources in their database taxonomy, and our hiring and onboarding of our first full-time staff members. And so things are moving along, and they're moving along at a great pace with good people and people who are well suited to serve our community, which is lovely to see. And obviously we're a newer call center. Our go live date was April 16th, so we're still constantly looking for volunteer Lifeline counselors and actively recruiting for more folks to come on board who are interested in this line of work, so that we can reach that 24/7 model as soon as possible. Our goal right now is late summer, early fall.
And what kind of response are you getting to to Lifeline, the type of calls that you're getting the most and so forth?
Absolutely. So, most of the time, because it is a suicide prevention lifeline, a lot of our callers are either calling on behalf of themselves, experiencing suicidal ideation, or having suicidal thoughts, or have acted on suicidal thoughts. And then sometimes we'll get third-party callers, so a concerned spouse or family member for someone in their life, and they're just looking for advice on how they might approach the situation, which is our job to kind of walk them and talk them through that and just understand really what's going on. But we get calls from a variety of different populations in the community too that struggle with stuff, military and veterans, suicide loss survivors, suicide attempt survivors, a lot of youth too. A lot of teenagers experience suicidality, Native folks, disaster survivors, people who have experienced intimate partner violence. So it really spans a large range of callers. And sometimes people call just because they need an information and referral. They don't know who they need to go to for a mental health examination, and so we'll help them with that too. So sometimes it's pretty serious on the phone, and then other times it can be just a referral.
So it doesn't always have to be a crisis call. It can be, like you said, just gathering information on who do I need to see? I need a referral type of thing.
Exactly. And well, as we move towards 988 and that grant that's coming down the pipeline too, our call center is really trying to situate ourselves so that we can be an active information and referral services entity within the community as well. And so we've been learning a lot from our partnerships and relationships with the Bozeman Help Center and the 211 Help Center and even 911 dispatch. We've had the opportunity to shadow them and just learn.
Okay. Is there anything else that you'd like to share about the Lifeline? It sounds like an amazing thing that's happening here for our community and really for the region, right?
It is. It is. And, Lifeline is a national model. It's not something that we came up with in Montana. This is a national model that's been in existence for a long time. I think, Tony, we were the 186th Lifeline center that we stood up in Missoula across the nation. And we are, we really did want to get ahead of it in preparation for 988, because 988 is coming by July of next year. It will be a national mental health crisis line. And so it will become the equivalent of 911 in the mental health world, and which really is going to get help, the right help to the people faster. Law enforcement does a great job out there with 911 response to psychiatric crisis. They know what to do and where to get the person and how to navigate that. The 988 model, it kind of streamlines it to a psychiatric kind of platform. That's where the split will come. And so the 911 operators across the nation are very, very thankful and grateful that, and they're well trained in all aspects of crisis, but it really will separate the mental health from, the typical 911 calls, whatever, that might look like. So we're really gearing up. So when 988 rolls out, we are ready, willing, and able to answer those calls in Western Montana. And any other calls that flow over to our center from other call centers that are at capacity on their call lines.
So your main message to our listeners, we have a new model of healthcare going on, and now we have Lifeline. What do you want our listeners to know the most? What's most important here?
My strongest message is that if you or a loved one or anyone that you know in your life is in need of mental health, we all need mental health help. I mean, I'm an advocate that it's not us and them, we are them. I say it all the time. It's all of us. And if you're in a position where you need to reach out for assistance, get in touch with a mental health help center and get the assistance that you need. I mean, I really would love No Stigma at some point in my life to watch No Stigma for mental health, but just the push to reach out. I've seen wonderful things happen from people who reach out and get the help they need.
Tony?
I would just piggyback off what Carrie said and just say, if you're a member of the community and you're struggling, just please reach out. We are here. It's what we do. And we care about our community.
And share that number one more time.
1-800-273-TALK.
Easy.
Easy. Soon
All right.
Easier. Some of the cell phone providers have already switched over to 988, and so we're watching that transition. But for right now, 1-800-273-TALK.